this. That's amazing. Great job. We need people to keep putting out, keep doing positive things in the community. Like Jenny said, my primary role for which I was hired at Pat's Place was to provide human trafficking coordination for the county of, the county-wide efforts. However, I also, a year or so ago, was tasked with providing all of our community education and training events as well. It's something that I was already interested in doing, and so I was happy to take on that role as well. So thank you for having me. I'll give you first just a quick overview of Pat's Place. We are a child advocacy center, which means we serve kids who have experienced abuse. So we serve all of Mecklenburg County. So any child where there's an allegation of sexual abuse will come and come to see us. We also see kids where there is an allegation of severe physical abuse, human trafficking, and then a witness to violence. Sadly, we do see more kids than we would like to who have witnessed homicide. And so they would come and to our center as well. So we served, I believe last year, 734 kids was the number of kids that we served. And we know that in this current pandemic, many kids are being abused, unfortunately, and don't have access to teachers and other professionals to reach out to. So we are definitely feeling the burden of those children. So we know that this pandemic is impacting them. I don't know if I can share my screen. I can go through, it'll help me just stay a little bit more organized, and there's some pictures on there. So I'll tell you a little bit about the work we do, and then how you can get involved if you wanted to. So
You should be able to, so.
Okay, let's see. Share. So. Okay, can everyone see that? Okay, I see nodding heads, great.
Yes.
That's perfect. So again, a child advocacy center, what you'll find when I give you this brief overview is that it's not just one agency, but we really work closely with the entire community, and it's really an interagency response system that we provide. Prior to a child advocacy center, if there was a child who had been abused, let's say example, poor little Robin here has been abused, she would go to school and perhaps she would tell her teacher, assistant, what's happening. Kids, we typically don't disclose abuse right away. We find that kids will tell years later, sometimes into adulthood, sometimes never at all. But the ones who do disclose, this would be kind of an example of what would happen. They would go to school and they would, get up the courage to tell their teacher's assistant. And then the teacher's assistant would say, okay, well, you need to go and tell your teacher what happened. So this poor little kid would have to tell their teacher. The teacher would then say, actually, this is something that a mental health professional really needs to be looking into. So little Robin would be taken to the counselor so that she could tell her story again. The counselor would say, Robin, we need you to tell the school nurse. The school nurse would then bring Robin to the principal and say, Robin, you really need to tell the principal what's happening at home. Finally, the principal would reach out and say, well, this is really a police matter. You need to tell the school resource officer what happens. And it's just for many, many reasons, other than the fact that this is obviously a very traumatic situation for Robin, this process does not work. Prior to a child advocacy center, we figured this was kind of the mess of what kids were going through. They would, and the example of Robin, she's told 6 people and she hasn't even made it outside of the school system yet. She still has to tell the police and the social workers at social services, and then the prosecutor. And then, so kids were telling their story an average about 15 times before a child advocacy center model was developed. So for many, many reasons, one, it's traumatic for the child, but also it impacts prosecutions. when you have a child telling their story this much as well. And so for those reasons, a child advocacy center was created. And it was actually a little girl in Alabama who was the brains behind it. Many, many years ago, back in the 80s, when this a little girl who was experiencing abuse was asked for the 15th time to tell her story, she finally looked at the person asking her the questions and said, "Y'all need to talk to each other. I'm done." And so it was a little girl that actually created what we have now, which is a child advocacy center model. And that's where all of the partners who are involved in a child abuse investigation come to one central location, which is the Child Advocacy Center, so that that child can tell their story one time. So law enforcement will actually come to our center, as well as the Department of Social Services. We have a partner with a partnership with Atrium Health, which I'll talk about a little bit more here in a minute. And then we partner with these other folks as well. So they actually come to the Child Advocacy Center, and now Robin will tell her story 3 times instead of 15 is what we're finding. So this is just far more effective for Robin, for the children that we see. It's far more effective also for the prosecution purposes as well, because ultimately, we want children to get help, and we want offenders to be held accountable. So at Pat's Place, this is our mission here. We coordinate the investigations through collaboration with all the partners I mentioned. And we also want to break the cycle of abuse through training, education, and community outreach, which is why, I love being able to present and talk to folks like y'all who are really invested in the community. So Pat's Place, like I said, we serve all of Mecklenburg County. That does include the outlying townships. So, Mint Hill, Matthews, Pineville, Davidson, Cornelius, and Huntersville, as well as the Charlotte metro area. We serve over 600 children annually. Like I said, last year, I believe we served 734 children. None of our services cost anything to the family. It's all provided free of charge. And referrals must come from law enforcement or social services. So we cannot take referrals from the general community or parents, or it has to be some sort of investigation that's happening when the child comes to see us. So that's why anyone that does suspect abuse, we tell them to go ahead and call law enforcement and social services, and then they will make the referral to us. So this is what our waiting room looks like. When families come in, we have a couple different areas for them. We have lots and lots of toys for kids to play with. Obviously, those toys are put away right now because we can't have kids sharing toys, but we have movies and things like that for the family to wait to be seen. So the process basically is, let's say there's an allegation. Let's say we're talking about Robin again. And if Robin had told her teacher that, that at night her, uncle comes into her room and gets into her bed, and, kids generally aren't very specific, so she'd probably just give a very general description and, say something like, he does stuff. That's what we hear. So then that teacher, once that referral is made to law enforcement, they would then call us and let us know we have a case that we need to see. So Robin and her family, non-offending family, we don't have the potential offender come. So the non-offending family would come to here. The first thing that would happen is they would be greeted by family advocates. They're the ones who provide support to the family through the process. They meet with the caregiver, the non-offending caregiver, and then they provide support. They help them guide navigating systems. I don't know if you've ever been involved in a criminal investigation, but it's very confusing. There's a lot of different layers. Sometimes we have families that are filing for custody or emergency custody. They're trying to get maybe protective orders against the offender so that they can't be around them or their children. And navigating all of that is very, very overwhelming. So we also, our advocates, educate the family about the dynamics of child abuse. Child abuse is extremely prevalent. Most people that don't do this for a living don't think about it on a daily basis. But about 1 in 10 children will be sexually abused by the time they reach 18. So just think about, any child or organization you're a part of. If there's 10 kids there, statistically one of them has been, is being, or will be abused. And then we provide referrals to community resources and other supports that they might need. One of the primary things that we provide are forensic interviews. To keep a child from telling their story over and over again, what happens is the child comes to get a forensic interview. And that is a person who is specially trained to provide these types of conversations with children. They are developmentally appropriate and they're non-leading, meaning we don't want regular, I say regular, but we don't want the parents or community members or school members or really anyone that's not trained talking to children about abuse. For many, many reasons, but primarily we don't even realize how much when we're talking to people, we lead the conversation without even realizing it. For example, I was trained as a forensic interviewer, and during my training, I was practicing with an adult who I work with who was pretending to be a child. And she said something about, my dad, he touched, my private. And I said, okay, well, what did his hand do when he touched his private? And that was very, very wrong, because that child never introduced the concept of hand. I had introduced that. And you don't even think about how much we're introducing things into conversations. But that is why we don't want to have people talking to kids, because all of that is detrimental for an interview. So we want people who are trained to ask these kids questions, because this training allows that interview with the child to serve as evidence in the investigation. So that conversation is actually preserved on a DVD, and that DVD can be shown in court if the case goes to prosecution. And so the way those interviews or conversations happen are legally defensible, meaning a defense attorney cannot, destroy that interview the way they could maybe a person who isn't trained asking children questions. So we have investigators that are watching the interviews from another room. So law enforcement and social services watch from another room. And the person who talks to the child is not going to be a person with a badge and a gun, which sometimes is scary for kids. It's generally a social worker. And so that's how we now ask kids about what happened. This is an example of an interview room right here. The interviews, like I said, are recorded, so there's cameras in the room. After each child is interviewed, they are offered a medical evaluation. The folks who provide the medical evaluations are through Atrium Health. It's a group of people who are trained in child abuse to provide the exam. It's a head-to-toe exam. They can test for things like pregnancy and anything that might be transmitted sexually. And they have cameras so they can take photos of abuse as well. And that is all they do. They are specialists in child abuse. And so again, that's provided free of charge. And for many of our children, it's important because these children may never have, may never go to a primary care physician on a regular basis. So this is a chance for them to see a doctor. Here's an example. This is what our room looks like. You can see it's pretty child friendly. We do offer mental health as well to as many of our clients as we can. We can't obviously, provide mental health to everyone, but we try to see as many as we can. The ones that we can't see at Pat's Place, we then refer out to other mental health providers around the community. It's really, really important that kids who have experienced abuse get the mental health support that they need. One of the things that primary things that we do is because we are kind of the ones who coordinate all of these different partners, social services and law enforcement and other folks in the community, healthcare. Once a week, we bring everyone together to discuss cases, and we, share information about the case. We kind of cross-train each other on different dynamics. And this is something that we do once a week. And we try to also provide continuous professional development for our partners as well. Anti-trafficking service coordination is my kind of my baby. What we found was, there wasn't really a coordinated way that we responded to human trafficking of minors in Mecklenburg County. There's a coordinated way we respond to traditional child abuse, through the way that I just explained, but the dynamics of human trafficking are very, very different. And so we realized we needed to respond in a very different way. So part of my role is to develop a community response protocol and do some data collection. And then any cases of human trafficking that get referred to our center, I would be the point of contact there. Pat's Place serves children from ages 3 to 18. So we, yes, as young as 3, believe it or not. Our human trafficking victims, we generally see them coming in starting around the age of 12. And so we'll interview them. And so they are a little bit older, and they present a different set of dynamics. And so it really takes kind of a specialization to work with our human trafficking kids, or kids that are being human trafficked. Our human trafficking, maybe you have, a young woman who believes that she is in love with her older boyfriend, who is then forcing her to engage in sex for money, has very, very different dynamics than an 8-year-old girl who's being abused by her dad. So it does take a specialization. So that's initially why I was hired, is to work on that. And then finally, prevention, education, and outreach. This is what we're doing right here today. We provide training for anyone in the community. All of our trainings are provided free of charge. We have one training that's called Darkness to Light, or it's presented by Darkness to Light. It's called Stewards of Children. I'll tell you a little bit more about that and how you can get involved and support Pat's Place. Again, we provide human trafficking outreach and education, and we just rolled out in-school child abuse prevention for children in K through 5th grade. And we rolled that out right as COVID started. So we have not actually been able to get in the school and present, unfortunately. So if you wanted to support the work of Pat's Place, there's a couple ways that you can do that. One is host a training for your church, community organization, whatever. We have a variety of topics. Some are just different types of child abuse, prevention of child abuse. The training that I mentioned earlier, that's provided by Darkness to Light, it's called Stewards of Children. It is a nationally recognized training. It takes 2 hours to complete, and it talks about the dynamics of child abuse and how to prevent it. I highly recommend it in any agency that works with children. It's also great just for parents and grandparents to learn more about what they can do to protect their children. I also very much encourage this in churches because we find that people who want to harm children go to churches a lot of times, unfortunately, because they have access to children And generally, our churches are a place of trust. And so we generally trust the people that we are allowing to watch our kids while we're in church. And so this is one of the places that I always recommend have it as well. While it's not traditionally a topic that we discuss in faith-based communities, it is very, very important. So any organization can have the Stewards of Children training, and again, that's provided free of charge. Once we get up and rolling again, hopefully our kids are back in school. You can definitely encourage schools to implement child safety matters. That's the curriculum I told you about, where it's kindergarten through 5th graders. And each grade has different kind of safety tips for kids to learn. We recognize that ultimately it's an adult's responsibility to protect children, but there's also, we can arm children as well with really vital information. And so that's what Child Safety Matters does, is it teaches them some safety tips, teaches them how to identify safe people in their life that they can reach out for, for help if they were to need it. And it's developmentally appropriate for each grade level. And we are now allowing schools to do that. That is also free of charge. Pat's Place covers the cost of all of our training and training materials. If you're interested in donating, one of the things that we always need is toys for kids. So each child that comes into our center, when they leave, they receive some sort of thank you gift. So that means we need 730 gifts for children throughout the year. That ranges from 3-year-olds to 17-year-olds. And so anything that, we have really a variety of anything, but we do have agencies that are willing to, will host a toy drive and bring us things. Anything like stuffed animals and stuff does have to be new. But, kids, love, art supplies and things like that. They love those kinds of things. And so we just really, any kind of gift that you would, for all ages, just to thank them for coming and being, for their willingness just to come in and share their story. One of the other things we provide for every child that comes through, and their family, and believe it or not, and our law enforcement partners love them too, are the bags of individual snacks, like the bags that have the Doritos and the Cheetos and stuff like that in there. Every child that comes through, when they come in, we immediately offer them a drink and a snack. Our goal is to make them feel more comfortable. After all, they are coming, some of them, enduring some of the worst abuse that you can imagine. And so we want to make them feel comfortable from the time they walk into the door. And the best way to do that, we have found, is to hand a kid a little bag of Doritos. The Doritos are the most popular. And so it's just something that we can provide not only for our families, but also our law enforcement folks. Sometimes our law enforcement folks come in, they haven't had the chance to eat all day. They've been working cases back to back to back. And for them to come in and be able to grab a bottle of water and a pack of, crackers is, it really means a lot to them. You wouldn't think something like that did, but it actually means a lot. So, if you can provide stuff like that. And then obviously, financially, we always, love to have people, donate. The other thing you can do is attend one of our events. The next event we have coming up is called Barbecue and Blue Jeans. It's scheduled for September 11th. My understanding is that we're having to change the format a little due to COVID. So generally, it is a event where Midwood Smokehouse caters, and we have barbecue and drinks and a live auction and silent auction. And it's actually, our events are really fun events. This year, I'm not sure what it's going to look like. Last I heard, they were doing drive-through barbecue. I don't know. They were looking for ideas. I said, what about sweatpants and barbecue? Because a lot of us aren't really getting dressed these days. So anyways, if you're interested, I'm getting included in the mailing list for our events, you can reach out to me and I'll connect you with our folks that are responsible for all of our events. But either way, it's going to be September 11th. I just don't know exactly what it's going to look like. Again, if you wanted to check out our website, it's patsplacecac.org. And if you wanted to follow up with information about any of the stuff I've talked about, or scheduling events or scheduling trainings, you can reach out directly to me. That's my email there, Shawna@patsplacecac.org. I'm going to stop sharing now and give people a chance to ask some questions.
We have a couple questions that were
did Pat's Place develop this in-school program, or is it a national program that you've adopted? The in-school program, Child Safety Matters, is a national program. It was developed by the Monique Burr Foundation for Children that is out of Florida. It is actually an evidence-based program, meaning it has gone through evaluation, testing, research, and evaluation. There have been 4 independent research studies about the program itself, all which show that children did retain the information. So it is a nationally recognized program, and it is in, I can't remember how many states now, but we purchased all of the licensing for it so that we can provide it to schools at no charge.
Quanta has raised her hand. So Quanta, if you can unmute yourself.
Yes, can you hear me?
Yes.
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 I really admire the work that you're doing, and I'm so glad that you're going to be in the program tomorrow, along with our group, with the immigrant team. I have a question about if you have any data available that reflects the success of your organization in terms of preventive as well as remedial programs, and also with the keeping the family unity intact. In other words, does the therapy or programs involve so that the child is not distanced and from the family? So do you have any programs that promotes family unit?
So I will try to answer the different parts of your question independently. There is data on the effectiveness once child advocacy centers entered the picture. I don't have it on me, but if you reach out to me, my email again is Shawna@patsplacecac.org. I can give you some of the research that actually shows the success in successful prosecutions and things like that happened once child advocacy centers were in place. At Pat's Place, we have some outcomes. Again, that is not my area of expertise. Reach out to me. It looks like you do want to get the data. So yeah, I can reach out to the people who handle our grant applications, who are the ones who have a lot more of that data. So I can absolutely get that to you. Therapy is always done with the child and with the family. So again, we understand that a child can't independently heal without the support of their family. We don't make the ultimate decision as far as whether or not families, the children remain in the home or taken out of the home, things like that. That ultimately falls to social services. But I will say in Mecklenburg County, the goal of social services is to keep families together. So when possible, they do keep the families in the home, but all of our therapy does involve the family as part of, as a component. So the therapist would spend part of the therapy session with the child, and then the other half of the therapy session with the family, because our families are integral in making sure that the child heals and child abuse is prevented in the future.
Okay, Kimberly has raised her hand.
And I see another question in the chat box. I'll grab that too. I won't forget that one. But
Okay, Kimberly.
Oh, down there. Okay.
I didn't raise my hand.
Oh, I'm sorry, it had your hand raised up there.
Okay. Oh, well, then I'll answer the question in the chat box that says, what happens if the child or parent does not want to talk to law enforcement, but others believe there is abuse? This is fairly common. So what happens is the referral is still made to us. If the child comes in and does not want to talk to the interviewer, we don't force it. That's just us forcing something else on the child that the child doesn't want. So what we'll do, we will try an attempt to interview the child. And if the child says, you know, I just don't want to talk, we say that's perfectly fine. What we do is we refer that child and the family to mental health services. And then through that process, if the child then at some point is ready to talk, then they can come back and we'll try and talk to them again. But without the child kind of telling their story, there's not a lot that our investigative partners can do as far as, you know, in some cases they can still prosecute, but a lot of times we do need the children to tell their story, unfortunately. And so we won't force that on the family. We'll let them engage in the services and then come back if they feel more comfortable later. And that definitely happens. Like I said, children do not disclose abuse as it's happening generally. It's just not typical. It's oftentimes much later that they start to tell what happens.
Shawna, what percentage, I know typically it's mostly females, but what percentage of males do you get who have been abused like that?
That's something that I'm going to have to look into, because we actually get, you know, our fair share of males. We used to say that there's some statistics, all of the data does support that females are abused more than males. That is absolutely supported in all research. However, what we see, I could not tell you off the top of my head. That's another thing I'll need to look at, but I will tell you we see more boys than you probably think we do. We also see quite a few cases of kids abusing other kids. About 30% of our cases are kids abusing other kids. So that's something whenever we do prevention training, we like to remind people. It's not, again, it's not the not that danger isn't out there, but 93% of abuse is perpetrated by people that the family knows, loves, and trusts, and 30% of what we see is actually other children.
And that 30%, do those abusers tend to be abused themselves?
Sometimes, but there used to be this myth that if you were abused, you were going to become an abuser. And we don't support that anymore. The data does not support that anymore. Sometimes they have been abused themselves, absolutely. Sometimes what we're seeing is kids that have seen things on the internet and then want to act it out with other children. So exposure to things like pornography can be a catalyst. The kid may not have been abused themselves, but that may be a catalyst. We also see sometimes where there's domestic violence in the house, kids will sometimes abuse other kids. And I'm not sure what the correlation is there, but we are seeing some of that too. So it doesn't necessarily have to be a child who was abused themselves.
Hey, Shawna, Kevin here. A couple of questions. First of all, do you know if you have a relationship or if you have the program you mentioned, if that's been rolled out at Sedgefield Middle School?
So Child Safety Matters actually has not been rolled out in any North Carolina school as of yet.
Okay.
We are the first ones in the state to have purchased licenses from Monique Burr Foundation. Their website lists, I forget how many states, but quite a few states have implemented it. North Carolina has not. North Carolina is a little behind on some of those kind of programming.
Yeah.
So we will be the first ones implementing it. We are looking for schools that are interested in partnering with us to roll it out. So if you have a connection at a school, we definitely
do.
Okay,
Yeah,
awesome.
we have, we're community partners with Sedgefield Middle School, and they're in South End. I want to point out for the information of everybody participating in the Zoom call today, is that Pat's Place is actually in the Dilworth South End area. So they're in our hood. We should be making use of their services and helping out where we can. I had one more question for you, and you mentioned DVDs.
Yes.
Is that like real? I mean, do you
Yes.
guys need an upgrade
Okay.
in your technology?
So unfortunately, that is not a Pat's Place decision. That is unfortunately a prosecutor decision because our court system has not upgraded to anything past
Oh my
DVD.
gosh, are you kidding?
Yes, I am serious.
Wow.
So because our court system is not using flash drives and other more updated technology, we cannot use more updated technology. So
Unbelievable. So do you
yeah.
have a backup system though? When you're making those DVDs,
Yeah,
it's important, I'm sure. So you do have a backup system.
we do. All of them are stored on a protected hard drive that we have in our a database that's obviously backed up and protected.
Great.
Those DVDs are considered evidence, so
Sure.
they're extremely important. That also means that parents cannot watch the interviews, nor can they get copies of the interviews without a court order, because that's no different than other evidence collected at the scene. So that evidence is solely the property of Pat's Place, the law enforcement, and then the district attorney if it were to go to trial.
Great.
Shawna, we also had a question earlier that Promising Pages, who is Eric and Kelly, they give out free books, used or new, and their question was, will those be good for gifts also for the children?
We allow the child to kind of decide what they want. So sometimes we'll do like a book and a gift, if we can do that. So books can be gently used. It's just things like clothing and teddy bears and stuff that cannot be used. But books are also great for us to have in the waiting room while families are waiting to go back there. It's a very nervous time for the kids and the families, and so generally having books, toys, DVD. We do have a DVD player there too, that they can all kind of distract themselves from what's happening.
Shawna, hi, this is Kelly from Promising Pages. Who would I connect with? Because I can fill your lobby up with books and kids can actually just take them home with them if they want, and we can just keep replenishing them. Who do I connect with to make that happen for you guys?
Reach out to me and then I will find out who the best person is to connect with on a regular basis. Off the top of my head, it's probably our front desk person, but instead of providing her information, you already have mine from the webinar. So just reach out to me and then I'll make the connection. We really appreciate that too.
Okay, thanks.
Anyone else?
Shawna, any other questions? Shawna, thank you so much. This has been incredibly helpful. What a resource to have in our own backyard. And I can share with you, I was in law enforcement for 30 years, including a local police officer and as an FBI agent. So I am very, very sensitive to child abuse and human trafficking matters, having worked a number of those cases. But I really appreciate what you're doing. We certainly want to look forward to having an opportunity to collaborate with you at some point in the future. I will be getting in touch with you and we'll figure out some ways that we can help support your mission and what it is that you're doing, because 700 plus kids is about 700 too many. And,
too many, and we know that there's a lot that we're still not reaching. So you actually have seen a lot of that as a law enforcement officer. So thank you so much for having me again. Reach out to me for any other follow-up questions.
Wonderful.
And how to connect. I'm happy to connect with you in any way that I can.
Wonderful.
And if you have anything in particular we can help with, please reach back out to me.
All right. Sounds good.
Wonderful.
Thanks so much.
Well,
Thank you so
Thank you
much,
again, Shawna.
Shawna.
Bye.
That's it, folks. Again, we're almost at our hour mark. I want to thank you all for joining us again. Thank you to John for the invocation and the pledge. Jenny, thank you for introducing Shawna. And Shawna, again, thank you for this very, very important presentation today. We look forward to working with you. I want to say thank you to our guest. I saw that Jean from the International Club joined us as well. So thank you, Jean. Thank you, Quanta, for participating. And I thank each and every one of you for joining us today. So if you will now join me in saying to yourself our 4-way test of the things we think, say, or do. Is it the truth?
The truth.
Is it fair to all concerned?
Is it the truth? Is it fair
Will
to
it
all
build
concerned?
goodwill and
Will
better
it build
friendships?
goodwill and better friendship?
Will it be
Will it be
beneficial to all concerned?
concerned? And will it be fun?
It be fun? That's the one thing we said in unison, Joy. All right, y'all. Again, if you can join us tomorrow, if you want that Zoom information for the New Gen Peace Builders celebration, let me know. If you want to join the board meeting, send Jenny a note, and we'll get you the link for that as well. In the meantime, have a great weekend. Be safe, be healthy, and look forward to talking to you guys and seeing you next week. Bye-bye.
Thank you, David. Hey, David, I got your stuff. Thanks, buddy. I appreciate it.
Hey, Bob.
Okay, thank you.
Take care, Al.